G'day, today we're going to look at what muscles make up your core and how to activate your core effectively, and then finally some exercises to help develop the strength of your core. So stay tuned.
In order to create a picture of the core muscles, imagine a cylinder with a top and a bottom. The top of the cylinder is the diaphragm. The bottom of the cylinder are the pelvic floor muscles. The front and sides of the cylinder are made up of the transversus abdominis, or the TA, and the back of the cylinder is the multifidus. It is important to maintain the pressure within the core, or this cylinder, in order to maintain safe and effective movement when lifting, doing exercise, and performing other daily activities. This will help with maintaining a safe and strong back position. It is also helpful to activate the core when you cough, sneeze, or laugh in order to help control your bowel and bladder. Looking at each of these muscles more closely, firstly the diaphragm. It's a sheet of muscle that extends across the bottom of the thoracic cavity. The diaphragm separates the thoracic cavity from the abdominal cavity and performs an important function in respiration. As the diaphragm contracts, the volume of the thoracic cavity increases and air is drawn into the lungs. The pelvic floor muscles are a layer of muscles that sit at the base of the pelvis and support the pelvic organs. The pelvic organs are the bladder and bowel in men, and the bladder, bowel, and uterus in women. The pelvic floor muscles stretch like a trampoline, front to back from the pubic bone to the coccyx, that is the tailbone, and side to side from one sitting bone to the other sitting bone. Just like a trampoline, the pelvic floor is able to move down and up. The multifidus muscles fill up the groove on either side of the spinous processes of the vertebrae, from the sacrum to the axis. The multifidus muscle plays an important role in stabilizing the joints within the spine. Dysfunction of the lumbar multifidus muscles is strongly associated with low back pain. The transversus abdominis is a muscle layer at the front and side of the abdominal wall, which is found beneath the obliques and rectus abdominis. It wraps around the lower torso, hence the name. Its action, together with the multifidus, is to create a corset-like support around the lower torso. And when they are working well together, they stabilize the spine and pelvis, helping to maintain posture during lifting and other activities. Static core functionality is the ability of the core to align the skeleton, that is the spine, ribs, and pelvis, of a person to resist a specific force, whether the force is static or dynamic. Because of the functional design of the body, during dynamic movement, there is more dependence on the core muscles than just skeletal rigidity as in a static situation. This is because the responsibility of the core is not only to resist a static, unchanging resistance, but to resist forces that are continually changing. This includes most activities in life. It is therefore important to train the core in a dynamic way once a general control and understanding of the activation of the core is developed. For example, you may start doing a stationary plank exercise, but you should progress from this exercise as soon as you can, or as soon as you are comfortable to do so, to a more dynamic movement. Functional movements cannot be formed correctly and safely without proper contraction of the core. The core muscles are designed to stabilize the spine and pelvis. In fact, in order to protect the spine, these muscles should switch on prior to performing any movement of the torso or of the arms or legs. If the core muscles are not doing their job, other muscles will come into and try and compensate, and it's these compensations that can develop into chronic pain.
The best positions with which to practice activating our core are either in a tabletop position, that is with your hands and knees on the floor, or seated on a chair or a fitball, or lying face up. Today I'm going to demonstrate a lying face up position. So we're on our back, legs bent, feet flat on the floor, head and shoulders relaxed. To demonstrate what we don't want in this position, if I put my hand on my abdomen around the navel or umbilical area and perform a crunch, I will feel my abdomen rise. When we activate our transverse abdominis, it should actually lower as opposed to rise. Now, the best place to identify that our transverse abdominis is being activated is if we find our hip bones, and it's on the front of the hip, and move our fingers 2 centimeters in and 2 centimeters down. That is the best position to feel the transverse abdominis when it's engaged. So in that position, if I just cough, then I will feel that transverse abdominis activate or contract. Now, to activate the core muscles correctly, so that includes transverse abdominis and the pelvic floor. For women, I want a feeling of squeezing and lifting within the vagina, and it's similar to stopping the flow of urine mid-flow. For men, it's a feeling of lifting your testicles up, which again is similar to stopping the flow of urine mid-flow, or walking into cold water. It's a similar sensation. Now, when we activate that core, we should feel about a 30% intensity. So we're not turning on that core as hard and strongly as we can, but to about 30% intensity. In doing so, the musculature around the ribs should be relaxed. Our back natural arch should be maintained, so that should not change at all, and our buttocks should also be relaxed. So there we have the technique to activate your core muscles. We're now going to go through 5 controlled core exercises that can help develop your core activation during movement. So back in our face-up position, we're breathing out as we activate that core, checking that it's turned on, and then continuing to breathe whilst maintaining that core activation. So we hold the core, we're breathing in and out for 10 breaths whilst maintaining the core. So there's no body movement, it's just breath and maintaining that engagement of your core. The next exercise is lowering one knee at a time to the floor. So once again, we breathe out, engage the core, whilst maintaining the core and breathing, we're going to slowly lower one knee toward the floor. Now, not only are we engaging the core, we're ensuring that our hips stay level as we drop the knee to the side, and then the other side. Hips remain level, core remains engaged, breathing freely. And we might do that 5 to 10 times on each side. The third exercise is lifting one leg at a time. Once again, engage the core as you breathe out, remembering maintain that natural arch in your lower back as you lift one leg and then lower that foot back to the floor. Lift and lower. Continuing to breathe naturally. Your lower back position should not change at all. And once again, you could do that 5, 10 times on each side. The next exercise is starting with both feet elevated, so both feet off the floor, and our knees are pretty much directly above our hips. We're breathing out as we turn on our core or engage our core. Notice that our lower back is still in that same position. We have that arch in the lower back. And then from here, we're going to lower one leg down, tapping the foot on the floor, and return the foot. Lower and lift. Our pelvic position should not change. Maintain the arch in your lower back. Continue to breathe naturally. Keeping that core engaged the entire time. You could do that 5 to 10 times on each leg. And then finally, the fifth exercise that we're looking at today is, once again, breathe out, engage your core, maintain the position of your pelvis, and lift both legs at the same time. And then lower both legs. You will find this far more demanding and will cause you to have to work a little bit harder to maintain that natural arch in your lower back and the pelvis level. Continuing to breathe. So once the exercise gets a bit harder, we can be prone to stop breathing and holding our breath. Ensure you continue to breathe in a relaxed fashion. And to make that a little bit harder, you can extend your legs out a little bit further, ensuring that lower back position does not change. So there we have 5 exercises that you can use to help develop your core, and then you can progress on to more complex exercises. Have a great day.